I'm from the Department of Infectious Disease, Peking University First Hospital. The protocol includes 13 parts. First of all, the epidemiological characteristics is mentioned by Professor Gao. It solves infection all the patients as source. And also, symptomatic infected people can also be a source of infection. We talk about the infectious case cluster that from asymptomatic infected people. The respiratory droplet and close contact are the main route of transmission. There are some the possibilities of aerosol transmission in a relatively close environment for long-term exposure to high concentration aerosols. Also, because we can isolate the virus from feces and the urine, so we should aware that the feces or urine contaminate the environment can lead to the aerosol or contact transmission. All the populations are susceptible to coronavirus, including newborn and to 100 years old person. There's new findings from the pathology. This finding is from the limited autopsy and the biopsies. The disease mainly damages the lung. You can find the worrying and the decreased lung solid change. Average damage involved the febrile myxoid exudation and hyaline membrane formation. And the exudates are composed of the monocyte and the macrophages. Alveolar intestine is marked with vascular congestion and edema, infiltration of monocyte and lymphocyte, and the vascular hyaline thrombi. The lungs are laden with hemorrhagic and necrotic foci, hemorrhagic infarction. The bronchi are filled with mucus and mucus plugs. This gives us a clue that we have to do the extraction of the mucus from the bronchi to get the gas tract clear. And a very important finding is that on electronic microscopy, we found the virus in the lung, even though the dead person. So give us a clue that we have to use antiviral agents all over the cause of disease. There are other findings that show the spleens, the lymph nodes, and the bone marrow was damaged by the virus. The spleen is evidently shrunk with lymphocytopenia and focal hemorrhage and necrosis, and the macrophage proliferation and phagocytosis. Lymph nodes bound with sparse lymphocytes, and the CD4, CD8 cells is reduced in spleen and lymph nodes. Also, we found the pancytopenia in bone marrow. For the clinical patients, the incubation period, as Professor Gao mentioned, is from 1 to 14 days, mostly 3 to 7 days. The clinical features, including fever, dry cough, fatigue, is the main problems. In severe case, dyspnea or hypoxemia usually occur in 1 week after onset disease. And the hypoxemia may rapidly progress to acute ARDS, septic shock, metabolic acidosis, and differential tract, bleeding and coagulation dysfunction, and even multiple bleeding. And should be awareness that patients with severe or critical illness may have no fever or even no fever. The elder person and those with chronic underlying disease have poor prognosis. The clinical course of pregnant women is similar to other patients, and in children is relatively mild. The laboratory tests, including the white blood cells, was normal decrease, with lymphocyte count decrease. CRP and ESR were elevated. Some patients showed increasing the liver enzyme or LDH, or muscle enzyme, and the myoglobin. In severe case, the dimer increased progressively, and the elevation troponin is seen in some critical ill patients. Severe and critical patients often have elevated inflammatory factors, including interleukin-6, tumor necrosis factor, etc. We have a virological and serological tests for the coronavirus infection. The virological data, including viral RNA, can be detected in nasopharyngeal swab, sputum, lower respiratory tract secretion, etc. And we recommend to collect lower respiratory tract samples, such as sputum or tract extraction, to increase the sensitivity. And the specimens should be submitted for testing as soon as possible. And we add on the serological test in this version 7. The virologic specific IgM antibody, IgD antibody, have been approved by Chinese FDA and can be used for the clinical practice. The IgM antibody can detect around 3 to 5 days after onset, and the IgD antibody is about 5 days later. We can detect the IgD antibody. The chest imaging is another very important diagnosis test detection. In the early stage, there were multiple spotted shadows and interstitial chains, which were obvious in the extraneous blood. Further, multiple ground glass shadows and infiltration shadows were found in both lungs. Lung consolidation can be found in some severe cases. This slide is an X-ray. You can see the infiltration shadows from the pleura, and then goes to the center gradually with the disease progression. And these professional CT findings also is the shadow, infiltration shadow, and glass shadows. You can see near the pleura, and then goes in the center with the disease progression. The diagnosis criteria. Suspected cases we can diagnose it as epidemiological histology and clinical features. For epidemiological history, including 4 parts, if one of these history in accordance with the clinical features, we can diagnose it as suspect cases. The history, travel, or residence in academic communities where cases reported within 14 days, or in contact with a positive people within 14 days, or in contact with patients of fever, respiratory syndrome from academic area within 14 days, and cluster cases. That means 2 or more cases with fever or respiratory syndrome in a small area, such as family, office, and school room, within 2 weeks. For clinical features, including fever, respiratory syndrome, imaging characteristics, and white blood cells normal decrease with lymphocyte decrease. If the patients, in accordance with any one of the history, with any of two clinical features, or all three clinical features, we can diagnose this as a suspected case. For the confirmed case, with the suspected cases with one of the following virological or serological evidence, we can diagnose this as confirmed case. Real-time PCR is RNA positive, or viral gene sequencing is a highly homologous for coronavirus. Or viral-specific IgM, IgG are detectable in serum. Or IgG alone detected from negative to positive, or the titration reach at least four times higher in the recovery stage compared with in the acute stage. There are different clinical types, from mild, moderate, severe, or critical. Most patients is mild and moderate, about 80% together. With the mild cases, clinical symptoms was mild, and there's no pneumonia. The moderate is a typical one. They show fever, respiratory syndrome with pneumonia. The severe case, in accordance with any of the following, the shortness rates more than 33 minutes, or they are in the resting state, oxygen saturation is less than 93%, or the arterial partial pressure of oxygen plus to a fractional effect oxygen less than 300, or the case with chest imaging progress very rapidly, more than 50% within 24 to 48 hours. All these situations we diagnose as a severe case. For critical case, in accordance with the following, with failure, a shock, or with other organ failure, require ICU care. These slides show the proportion of clinical types in different areas. The right hand, you can see this is all over China, the nationwide. The most patients show this mild, moderate situation is about 80%, and the total severe and critical is about 17.5%. But in Wuhan area, in severe cases, most cases there. This is a proportion of severe case with the age. With the increasing of the age, the severe case and the critical case increase. You can see this yellow one is a severe case, and the red one is a critical. You can see this is from 0 to 90 years old. Again, if the patient is high age, the higher the severe case and the critical is having. This is the death proportion of different age. You can see similar things with the severe and the critical case. The higher the age, the higher mortality. With 35 years old, under 35 years old patients, there are very few patients dead. The case finding report, I think Professor Gao mentioned, all suspected cases should be immediately in single room for isolation and treatment. And all suspected cases should be reported directly within 2 hours. And the sample should be collected for RT-PCR test or serological test. And all the people have been close with the patients who have been confirmed a new coronavirus infection are advised to perform new coronavirus test in timely manner. We can detect the viral RNA in 1 day all over China now. I'd like to talk about the treatment. So far, there's no confirmed drugs for the coronavirus, COVID-19. So, supportive treatment, oxygen treatment, is very important. First of all, we treat the patients with different severity of disease. For suspected or confirmed case, should be isolated and treated at the designated hospital with effective isolation, protection, and prevention conditions. For the mild case, we go to the cabinet hospital. And for the severe or critical case, all the patients have to go to the designated hospital. There is a general management for the patients, the rest and symptomatic support therapy, sufficient caloric, water, and electrolyte, also monitoring the vital sign oxygen situation, and other laboratory tests. Early oxygen therapy and airway drainage is very important for all the patients. There are no confirmed antiviral agents so far, but in China, we recommend some drugs that are already on market try to use COVID-19 treatment. And we do find some promising efficacy data, especially fluorine phosphate. It's work in some moderate and severe case. The publication will come in soon. And also, there's some co-effects with bacteria fungus. So antibiotics, antimicrobiology drugs is very important in the early stage based on the diagnosis of the disease. With experience combination, we collect some warning indicators for severe critical. We have treated these patients earlier before this goes worse. For example, the peripheral blood lymphocyte decrease progressively or progressively elevation of inflammatory factors such as interleukin-6, CRP, and the lactase sustain a progress elevation or lung lesion develop rapidly in short period. This slide shows the D-dimer and the lymphocyte can be an indicator for the severe or critical illness. This published in the Lancet recently. You can see the dimer in the non-survivor increased very rapidly. With the survivor patients, is stable. Also, the lymphocyte levels is decreased or very low levels in non-survivor in that person. Compared with the survivor, is increased and stable in high levels. And this shows the interleukin-6 and serum ferritin. In very similar profile, you can see in that person, both interleukin-6 and serum ferritin is progress increasing dramatically compared with the survivor. It's stable, it's in low levels. And this will show another troponin. Troponin is a very important marker for the critical illness. In some critical or even dead person, the troponin increase dramatically and cause the disease progression. And similar is lactase. If the lactase level increase progressively, is imply that the disease progression or even death. So with this predictor, we can treat patients very seriously in the early stage to control disease progression. And the protocol for the severe critical case treatment, we have specific protocol for this part, for severe critical, including respiratory support, circulatory support, the renal failure treatment, convalescent plasma treatment, and blood purification treatment, immunotherapy, socialism, or other therapies. I just highlight some therapeutic strategies. Oxygen therapy is very important in all the patients, from the nasal or mask oxygenation to high flow nasal catheter oxygen, or non-invasive mechanical ventilation. If patients didn't get recovered from the general oxygen therapy, the invasive mechanical ventilation evolved, or even rescue therapy with the ECMO or other techniques. Convalescent plasma treatment have been confirmed that it's effective in severe patients in the early stage. So the indication for the convalescent plasma treatment, including the patients with rapid disease progression or severe or critical disease. And the convalescent plasma donor should meet the following criteria, including no less than 3 weeks after the onset disease, in accordance with criteria for the isolation and discharge, and age from 18 to 15 years old. And the weight, we also recommend that the weight is another criteria for the donor. And also we have to evaluate by to fit the criteria of the donated plasma. Usually we use the infusion dose is 200 to 500 milliliter. There's another important strategy for the COVID-19 is blood purification treatment if the condition allows, because there is a cytokine syndrome or inflammatory syndrome. The blood purification is a very effective method to deal with this situation. For local steroid we restricted to use local steroid, but in some patients with progressive rapidly, we can try to use the local steroid for 3 or 5 days with not very high dosage. There's another treatment including intestinal microbiological registers that can prevent the secondary bacterial infection, etc. It's another, I think, this important treatment for COVID-19 patients. And traditional Chinese medicine, we use, in most patients, use traditional Chinese medicine from mild to severe or even critical patients. We do find it's effective in some cases. This slide shows the criteria for the isolation and discharge. If the body the temperature back to normal, more than 3 days, or respiratory syndrome improve, or pulmonary image show aberrant absorption of infection, and 2 consecutive negative RNA tests, we can discharge the patients from the isolation. The management of patients after discharge, we do find some patients really positive with the RNA. So after discharge, it's recommended for patients to monitor their own health status in isolation for 14 days. We suggest the patients wear the mask while in ventilated single room if possible, reduce close contact with family members, separate dining, practice hand hygiene, and avoid going out. So also we monitor the blood tests and the vital signs, including temperature, pressure, blood pressure, etc. And designated hospital should contact the primary healthcare facilities where the patients live and share patient's medical records. And this is a very important communication between the designated hospital and the community to make sure the patients isolated at home for 14 days. Okay, I will conclude my talk. COVID-19 is an emerging infectious disease. The many aspects still need to be elucidated, including pathogenesis, pathology, etc. Early diagnosis, early treatment is critical. Effective oxygen treatment are very important. We'll update the protocol with increasing underlying understanding of the clinical manifestations and pathology disease, and with the accumulation of the experience in diagnostic treatment. Okay, thank you for attention.